Thank you, gentlemen. I enjoyed your testimony, all of you. A couple things, enjoyed it so much because you agree with me. Perhaps one of you spoke of, Dr. Krug, perhaps, the need to have professionals, healthcare professionals, to be able to go across lines and have liability protection. I was a practicing physician when Katrina hit. There was an orthopod at the New Orleans airport. The FEMA people would not allow him to set somebody's broken bones because he was from out of state and they were concerned about liability. So I think we need a good Samaritan, which gives, and eventually our governor said, hey, listen, if you're from out of state and you're in good standing with your state, you have blanket protection. But I do think we need that on a federal level as opposed to the patchwork. I'll say that, and I've introduced a bill with Senator King entitled the Good Samaritan Health Professionals Act that would do so. And secondly, I think Drs. Krug and Inglesby, you've spoken, and Dr. Dresner, thank you. The need to have a public health emergency fund, and Senator Schatz and I have introduced something such as that. That would, just as FEMA has dollars, it doesn't need a special appropriation, but rather can go and when an emergency hit, the dollars are appropriated, and it cannot be encumbered and put in escrow by another effort. Those dollars are there. Still has accountability. To get a second tranche, have to come back to Congress and get approval. GAO will make sure they do it. But we also take care of contracting, because the previous CDC director said at Ebola, he had to get 10 sign-offs on travel vouchers for people to go over to West Africa, and that slowed the response. He had to contract with NGOs for them to contract to get transportation for people and goods. We're trying to circumvent that, and again, Schatz and I have put something together as regards that. Now let me hit on some stuff which perhaps is a little bit more provocative. Dr. Inglesby, you speak about the need to maintain this international network. Theoretically, World Health is doing that. I'm not sure we're getting bang for our buck with World Health. Now, you probably have relationships with them, so I don't mean to put you in a bad position, but if we are funding internationally World Health and the CDC is having to do it separately, that doesn't seem, in a time of scarce resources, wise use of resources. Thoughts?
Yeah. The World Health Organization has some of the best experts in the world on diseases around the world, and they are kind of the normative agency for setting policy and guidance around the world, looked up to for the world, but they are not a strong operational agency. They don't have resources for going to train the world or to build labs around the world. They have some money for that, but their budget is constrained as well. They depend on donors.
If they had the money, do they have the capability of doing it?
Not right now.
Yeah, so that seems we are having to supplant a international organization with a Centers for Disease Control, and I understand why we're doing it, but it almost seems like we're compensating for something which should have the responsibility already.
Well, what I would say is that the CDC and about 65 other countries are all contributing in some way, some of them with a lot of money, some of them with just their experts, but the Global Health Security Agenda was a way of getting a large consortium of countries to go out and help.
I get that, and I'm not objecting to it, except insofar as it seems like World Health should be doing that. Let me move on.
Okay.
Now, you mentioned about having regional areas of expertise. Let me go back to my formative experience with Hurricane Katrina. When the fecal material hit the fan, it was it just overwhelmed anything. Now, when I went to Haiti as a private citizen after the earthquake there, I was struck that the Israelis came in and they just like plopped down a hospital, unfolded it, and every capability they needed was there in a field hospital. I almost think since a public health emergency could happen in Baton Rouge, Shreveport, or Topeka, or you name it, how does every region have that kind of expertise as opposed to a public health hospital that may set up in your local VA, which is already a government facility? Boom, we've commandeered, we're taking it over. It almost seems a better way to respond because then you truly have expertise that's deployable in a moment. Any thoughts on that?
I do think that we should be able to rely on the local institutions, so VAs are a great source of strength in some cities, but the National Disaster Medical System and the DMAT teams, I think, are the teams that some of the teams responded to Katrina, they responded to Harvey.
But let's go back to Ebola, which is very specialized. You had to take off your booties in a correct fashion,
Yes.
or else you were exposed, as happened to the nurse in Dallas.
Right. So the U.S. was not prepared to send doctors and nurses to Ebola. We sent public health specialists, but they didn't take care of patients. They weren't allowed to take
But
care
my
of patients.
point is, as long, would it be better to have that sort of expertise that truly could go to a community and boom, we're going to be the expeditionary force. I'm sitting next to a Marine. The healthcare expeditionary force that is going to be able to manage this, and we don't have to have a lot of in-service because these people are hitting the door right now. We'll give you in-service, but in the meantime, we'll provide direct care, and that way, whether it's Baton Rouge or Topeka or New York, we know that we have expertise deployed.
Yeah, I do think it'd be very valuable. We have something like that on a much smaller scale called the DMAT teams.
Yes, but DMAT is more generic. They came to.
Fair enough. I agree with you. Yeah, I think we do not have infectious disease-oriented or Ebola or contagious disease-oriented teams like the ones you're talking about. And I think nationally and internationally, it would be good for us to be able to build those teams.
I yield back. Thank you.